Hi everyone, it is Dr. Sharon Livingston with Dr. Ali Shazoy again, and we are on our fourth installment of this series on how you can treat your face and treat it. So, Dr. Ali, what are we talking about today?
So today we're going to talk about neurotoxins. So these are remember that 3Ds that we said before, that was descent and deflation and degradation. So this is now the third is the degradation basically, which is means small, tiny, fine wrinkles and also skin damage and sunspots and other stuff. So neurotoxins is one of the way to actually modulate, which we call it neuromodulator, basically, so that we the muscles which cause the wrinkling, we use this material to relax those muscles and get rid of wrinkles.
So when you relax the muscles, it allows the skin to smooth out.
Correct.
Versus
correct. Yes.
crunching.
Exactly. So basically what will happen, suppose most of our muscles of the face, when we do the animation, these are all, whatever expression that we have, these are muscles. These are muscles which pull the corner of the mouth, muscles which puckers the lips, muscles which wrinkles the corner of the eye, muscles which lift the eyebrows, muscles when we frown. So these are all small, tiny muscles that are actually causing all that. So what will happen that the neurotoxins that we are using relaxes those muscles, so that's why the amount of wrinkling and the amount which occurred normally, we make it less.
And I want to say, no matter what your mother told you, if you're of that age when your mother told you that, no matter what your teachers told you, smile, laugh. It's really okay, because we have solutions to getting rid of those laugh lines.
Yeah. And moreover, the thing is, laugh line, they say it's laugh line because laughing, it doesn't make the lines actually worse. Basically it shows more, yes, because once you go there, this extra skin has to go someplace so you see it. The reason that it happens because after that deflation, it will make it more marked. So that's why, I agree, absolutely, laugh, because when you laugh, you are
you're exercising your face.
Exactly, you're exercising the muscle which makes you keep you happy face, give you the happy face. So do that. Absolutely, I agree with that.
Okay, and so you called them neurotoxins, and
yes,
there are more popular names. What are some names that people might know who would not know what a neurotoxin?
So basically, the commonest, the most popular one is Botox, that we have it here basically, and the other one is Xeomin, which is another one made by Merck, which I like also, and the other one is also this part, which is another. They are all basically botulinum toxin A, type A, which is basically this is the bacteria when it produces this toxin, and that toxin goes inside and goes to called a neuromuscular junction, where the nerves enter the muscle. So this toxin goes there and block that junction, so this way the muscles which contracts, every time that the nerves comes in, the muscle contracts, it prevents that contraction. So one of the reasons that people actually wrinkles is the consistent contractions of the muscle. Suppose if you've been doing from as a child, you keep on doing this. So keep on doing that, so finally the crack happens. It's the same concept that when you have a credit card, when you try to break a credit card, well, after a few turn and twist, and you can see that white line.
That's very interesting.
Yeah, so
that's
that
cool
white,
way of describing
exactly. So that white line appears in the middle. So after that, even if you iron it and you fix it, still that line doesn't go away, because now that there's a crack in the skin. So the same thing would happen in the line in the skin. When the lines become permanent, that's basically a crack in the skin itself. So one of the things that we do, try to do it and prevent that. So that the earlier you start, before the line appears, so that you stop that constant motion. And once that constant motion stops, you're actually preventing that cracking of the skin.
So you're preventing a deep wrinkle.
You're preventing, yeah. Because at the beginning, when we say that when we are at the beginning, when we start these things, okay, don't do these things when you're 30s and 40s or 50s. But now, actually,
so that's a mistake. You want to start early.
I said nowadays, because the money studies has come out, the earlier you start, actually, the better it is, because you're preventing that action. And before the line stops, when the line starts, you can make it lighter, you can make it less prominent with the neurotoxins, but you can't get rid of it altogether.
So when you say neurotoxin, I can hear all the way across the country, all the way, north and south. Neurotoxin, why am I going to put a toxin?
Yeah. So basically, we have an experience for this more than 20 years. So the thing is that the amount that we use and the type of the toxins that we use is so little, and the amount of dispersion, what we call it, the amount of as far it goes, is so little that really it's very
local.
Exactly. It's very rare to cause any side effect.
The reason that I'm bringing that up is that I happen to know from research I've done for pharmaceutical companies and stuff over the years that Botox and other neurotoxins have been used for headaches.
Correct.
And, in terms of being dangerous, there's no danger whatsoever. Really, the possibility of side effects is minimal. And can you imagine people with migraines getting rid of headaches after having them for years?
Yeah.
So it's an extremely safe intervention.
Absolutely. Yeah, definitely any muscles that you want to reduce the spasm. One of the reason for migraine, because it tightens up the muscles, so you relax those muscles. The another thing is that also lots of these muscles, we have got these tics or torticollis or something, that these muscles which tightens up, actually you inject them and loosen them up. That's not, of course, the cosmetic aspect of this thing, but there's lots of clinical
Evidence and proof,
that you can use Botox for that, and for anything like sometimes even the anal fissure, you can get to relax the muscle there. For any kind of that there is a tightness or muscles that you want to relax, you can use them.
Who's a good candidate for Botox or Xeomin or Dysport?
Yeah, actually everybody. That's what's one of the good thing is that because we all age, and during aging we do these muscles contract, and eventually the lines do drop, and to prevent them, anybody who doesn't want those things to happen is a candidate.
I mean, has Clarissa had it? I mean, her skin is amazing.
Yeah, her skin is perfect. So she doesn't need it, but again, we can. So basically, it comes in a box like this, and then it comes with like a powder. Let me see if this how are we going to go? Starting from glabella here, and then 2 on each side, and then with the marking we can mark. They don't have to mark, but again, I could mark. So it says that depending on the muscle, everybody's a little different. So there's not a set way of doing it. So some people have got only 2 strong muscle here, we've got 1 line here. Some people have got 3, some people have got 2. So it depends, everybody's a little bit different. Depending on that, so I usually ask the people, okay, frown. When they frown, I see how many lines, how many muscles and structures on these sides.
So I think there's a miracle to this. This is my own personal opinion, but so many people will get the lines between their eyes,
right,
and then people think that they're angry because their eyebrows are knit together. And so, particularly for people who are working in the public,
right,
if you want to appear less angry and you do the Botox between, or whichever one it is, between the eyebrows, it gets rid of that.
That's true. That's true.
It's like a miracle.
Yeah. And the other popular place, of course, is the forehead, because we do that, and that will give that. And the other thing is that on the corner of the eyes, what we call the crow's feet. So we can inject there, so we can lift a little bit of that eyebrow, that give you that like little nice arched eyebrow that people like. And the other thing is that we can do a little bit around the eyes, not too much, because some wrinkles around the eyes. I usually also give them a little bit on the corner of the mouth. I call them for the Mona Lisa smile, because it gives you a little bit of a lift on the corner of the mouth to bring it back up. Sometimes the other thing it's called Botox lips. So basically we give it on the lips itself. It gives you the edge of the the muscles deeper, gets a little bit weaker. It gives you a little of a roll on the thing, so it gives you a little bit of an edge on that. It's called Botox flip. For another thing that we can be used for is called gummy smile. People, when they smile, really can see lots of gum. So we can just inject a few injections here, and it will drop that and get rid of that gummy smile.
So you only see the teeth and not the gums.
Correct. So the other thing is for people who have got very big, tight jaws. So we can give them this muscle called masseter muscle. So when you tighten it up, you can feel it. So that's the masseter muscle. And then we inject on that, and then relaxes those muscles, so that will help at the same time to kind of reshape the jaw. And when you do it a few times, these muscles, the word is called atrophy. So the muscles become smaller. So people with big, thick jaws, especially happens with Asians, they like that to to chill out that area. So basically the jaw becomes less prominent and give you more like an oval shape rather than the square shape.
What's really interesting is that, when you show this knitting and
Yeah.
this pulling,
Yeah.
that's an angry looking face.
That's right, yeah.
And so that softens and makes the person look more approachable and engageable. Right? How long do they last?
That's a good question. It lasts on the average about 2 to 3 months. But I've got a few patients who they gobble it in a month. I mean, so those are the people, they feel so bad because when they come back, they have to spend the money.
Their bodies metabolize
Yeah, because
it faster.
metabolizing a bit faster. But usually on the average about 2 to 3 months.
That's very, very interesting. I know of some people who said it lasted 3 to 6. So
Yes, that usually when the patient comes, I explain, I said, okay, on the average is 2 to 3 months, but I've got those my 1-monthers, 1.5-monthers, and I've got my 4 or 5-monthers too. So I don't know where you're going to fall. And also depend on how quickly you want to go back and do it, because once you do it, it takes about a week. First of all, another thing, it takes about a week, 7 to 10 days to get the full effect. And I usually recommend before it goes all the way back to zero, start putting back on,
Right,
because otherwise
right.
you have to start from zero again. So that might be to prevent it. You have to use again large amount.
well, and I noticed that you showed 3 different versions of it.
Yeah.
And are there advantages, disadvantages to each one, or
Yeah.
how do you?
One time that I switch is that some people, when you use the same product again and again for a while, you may get used to it a little bit, your body, and then you may need a little bit higher and higher dose. So that's why it's not a totally kind
Interesting.
of, yeah, so it's not really a resistant, but it gets a little bit of resistance on that. So basically,
So if you switch,
then you switch, it may work a little bit better when you switch one product, and maybe a couple of times you do now switch, let's do the other product and then go back to the to original product. So this way, mix and match, it might make that resistance a little bit less.
does it hurt?
Not really. I mean, the thing you saw that the tiny
Really
little
tiny.
needle, exactly. And the other thing that we can do, this is a little vibrator. So what we can do, we can put it on. So while we're injecting, when we put this on, and that will kind of it's just
That's cool.
just a regular vibrator. So we put it on. So that basically it fools the nerve, and then it makes that experience a little
So
bit less
interesting.
painful. Yeah, so that we can do. And also the other thing, sometimes we can put a little bit of ice before that. When you ice the area, and then injection is going to be much better. Sometimes people says, why don't you give me some numbing medication, some topical numbing? First of all, topical numbing, it takes a while before it works. It takes about 30 minutes for the topical to work. So if you put the topical, so you may not feel the injection going in, but once you inject the material that causing the swelling of the tissue, that you will still feel. And that's most of the pain on the injection of the Botox. Is not that the needle going in, it's just when you inject that the tissue expands, and that expansion of the tissue causes the pain. And usually that topical anesthesia will not take care of that. So that's why I said it's really not much of a difference if you...
So when you do it with the vibrator and the ice, do people complain?
Not really, no. No, again, when I say that, because aesthetically acceptable discomfort, that should be that way.
You were showing how many units you use, and you're showing. So typically, like, how much do you need for what?
Yeah, that's a good point. So it depends also again on the person. Suppose if a person has got a big, thick muscles here, and they just going to use 30, 40 units right up here. But somebody who's got very thin muscles, and then may use only 10 to 12 units right here. And same thing here. If you've got someone with a small forehead and only one line in the middle, then probably about 20 units here. But if somebody have got a large forehead and they've got lines keeps on going, then it's going to need more units. So that I would say just typically about around 20 units here, about 20 units here, about 10 on each side, on 20 units there. So on the average, about 60 units is going to work on that. But again, it doesn't have to, because I have got people who have got, okay, I'm just going to do here, okay, just 20 units is good enough. Some people, because of the budget, they say, okay, doc, just give me 20 units and that's all I want. The disadvantage of that, it may, first of all, it may not give you the effect that you want, and also it may not last as long as you want. So those are the things that we have to do, because if you use less, then those are the possibilities that it could happen. So, but again, 40 units I think is a good number on the average.
What does something like that cost?
Again, so cost is different again because depending on how many units you put.
Let's say the 40.
Yeah, so if it was 40 units. We use 14 units per $14 per unit. So we did calculate it, and it's going to range about that thing. And we've got usually run some promotions as well to make it a little bit less expensive, but that's the average.
So like around $500 for 40 units. A little bit more.
Yeah, so 500,
560 or something.
560, yeah, exactly. That becomes what the.
I used to be good in math.
I know. I still, since it's calculator comes back, I can't calculate in my head anymore.
And you know what? I don't remember phone numbers anymore. I just see, call Dr. Alley. Oh, what's his number? I have no idea.
Same thing with
and I used
me.
to know all the numbers.
I know. Same thing with me. Even my children. The only number I remember is my wife. By heart, there is one I remember.
Is it possible that there's some people it wouldn't work for? I can't imagine it wouldn't.
Yeah, so basically, that I said before, like a Botox resistance, so it's a possibility that if you give a large enough dose, it will work on everybody. Sometime, so that's why when people get a bit resistance, you have to give a more amount. So it's not a real resistance, but again, so that means requires more units to work as much as it did before. Or some people who are a little bit metabolizing it faster, again, lasting may not be as much as it on the other people. So that's the depending on the metabolism.
Okay, so in terms of our 3Ds, we're talking about degradation, right?
Yes. Yeah.
And so the Botox-like products are one of the things you can do for degradation.
Correct.
In our next session, what are we going to talk about?
I think maybe next section we probably will talk about lasers. That would be a good thing to do because we have got different type of lasers. Probably I can show the machine and I can also different type of lasers. What are each laser's type? Maybe we can do that. Would be a good way to go.
So stay tuned. When we see you next time, we're going to be telling you about laser therapy for the degradation of the skin.
Yes.
Excellent. Thank you so much.
Pleasure.
Oh, you know what? Let's remind people, how do they get in touch with you?
Yes, again, so they can go on our website, englewoodcosmeticmedicalspa.com, or they can call us at 201-569-0920. I remember this number.
Thank you so much. We'll see you later.
Take care.